Last year, emergency rooms in Edmonton saw more than 25,000 distinct visits from patients experiencing homelessness. They get treated only to end up back in need of care again.
And then you have to be discharged. Well, we don't have any place to send you. So what do? We discharge you to homelessness again. That system is really broken. What today says is those days are over.
But a first-of-its-kind center opening next week in West Edmonton. Short-term transitional housing for those discharged from the ER.
Really focused on, again, moving people through the steps needed to access housing. So we have trained housing workers and caseworkers who know how to secure housing for individuals who have experienced houselessness.
Before this announcement, Jasper Place Wellness Center had actually fundraised to open up their first 12 beds. But now all 36 can open with the backing of Alberta Health Services. It comes as data shows amputations due to frostbite are at a 10-year high in Edmonton. Alberta Health Services pointing to last year's particularly harsh winter, coupled with a homeless population that grew during the pandemic.
Devastating injuries. I just saw one the other day that I'm still reeling from. So it's very complicated. For a lot of folks that end up with frostbite, there's more than just the frostbite. There's mental health issues and substance misuse issues.
This center hoping to help not just those with frostbite, but mental health and addictions issues and other chronic conditions. Premier Danielle Smith on hand for the announcement, crediting the funding to recent reforms in Alberta Health Services, while the opposition NDP taking aim at the UCP for the recent rise in homelessness, saying they downloaded costs onto municipalities while being derelict in their duty to build affordable housing. The City of Edmonton did provide initial funding for the center.
The city has been asking for the province to step up in the realm of housing and homelessness, the opioid crisis, for quite a while now. I think this is a start, but a lot more work needs to be done.
The cost per person at the center is about $80 a day, much less than a hospital visit.
Our rough estimate is that this is going to save the system and society an enormous amount of money. But not only given that, just think of the impact on the individual themselves.
In West Edmonton, Carly Robinson, City News.